A substance use disorder involves repeated use of chemical substances leading to clinically significant impairment during a 12-month period. Substance use in addictive disorders are characterized by loss of control due to substance use or behavior, participation that continues despite continuing associated problems, and a tendency to relapse back into the substance use or behavior. Now take a look at this in a meeting.
Good evening, and welcome to Narcotics Anonymous. My name is Lauren, and I'll be the nurse here facilitating this meeting. Today with me, we have Beverly, who will also be facilitating the conversation as we go on. Beverly?
Oh, all right. So does anybody want to volunteer first? Speaking. All right, Ash, would you like to volunteer?
Yeah, of course.
Do you want to tell us about yourself and why you're here today?
Sure. Hey guys, my name is Ash.
Hi,
Ash.
Hi. So I've been clean for 12 years. I started using, well, I would say probably 13 years ago. I was in nursing school. I became really depressed. I was in school and working. And as a student, I started stealing morphine at the hospital and started just injecting myself. And things just, well, it got worse and worse after another. And, well, I came here and things are a lot better and I'm doing fantastic. But yeah, that's about it.
Thank you. And how are you feeling today?
I'm actually doing really great. Tired, exhausted, but great.
I see you're pregnant.
I am. I'm actually 6 months pregnant. My third child. Super excited. My husband and I are super excited.
Awesome.
So one of the things that we encourage here in our meeting is the support of family, being able to get your life back on track. And in Ash's case, she was able to find someone who helped her through such a hard time, and years later is now happy, pregnant, and expecting yet another child with her husband.
Yes.
Thank you for sharing today.
Awesome. Anyone else want to volunteer speaking?
Well, I can go next.
Okay.
Hi guys, my name's Melissa.
Hi, Melissa.
Hi, Melissa.
Hi. So I haven't touched anything in about 2 years. I used to be addicted to Norcos, and I still have that feeling all the time. But I have some good support systems, and I come here to NA, and I'm able to just release some of that pressure. However, I hurt my back a couple weeks ago in a car accident, and so I went to the doctor, and the doctor said, take some pain meds, here's some opioids, and I said, no, so I'm actually in a lot of pain, and I'm having a really hard time trying to stay away from it.
So how are you feeling about trying to stay away from it?
It's tough. It's really tough. I physically want it. I crave it. I can, just the thought of it makes me just feel so much better. And so I feel like I want it, but I'm staying strong, and that's why I like to come here for support.
That's good.
Melissa, thank you for sharing your story with us. One of the things that you can do that are non-pharmacological interventions could be physical therapy, possibly seeing a chiropractor, walking, stretching, or even yoga. And if that might not work, some other interventions on the pharmacological side could be alternating between Tylenol and Motrin every 4 to 6 hours. Okay?
Okay, I'll try those.
Okay, no problem.
All right. Alicia, do you want to share?
I guess it's my turn. My name is Alicia.
Hi,
Hi.
I last used about 9 hours ago. It's been a rough day. I've previously been sober for about 6 months. My drug of choice is oxys. I have a really high stress job. I work for a really big law firm in the city, and it's just been really bad lately. I've been working 90-hour weeks. I've not been getting much sleep. My head's been killing me. And I'd been trying to stay sober, but we had a huge trial coming up, and the stress just kind of got the better of me. And I used a bunch of pills before I went to court. And I was having trouble staying awake. I was really out of it, and opposing counsel was a total jerk. I popped off at him and kind of cussed him out in court. And the judge told me not to come back for the rest of the day, and really almost ended up in jail on contempt. So it was kind of my rock bottom. I was trying to stay sober on my own and kind of keep it quiet because I don't want trouble at work, but it's affecting my work now. So
So, how are you feeling today?
really stressed out. Everything kind of hurts. I've been sweating. I'm really nauseous now that everything's kind of worn off, and I can't stop shaking. I'm tired, but I can't sleep. My stomach's really torn up. I feel terrible. I just sweated through my jacket at court. I mean, it was bad. So I just don't really know where to go from here.
Well, group therapy is a very good first step. So you're doing good being here.
Alicia, I hear that you tried stopping prior to this time today. Has there been any medications that you might have taken that were prescribed to you that kind of helped you during that withdrawal period? Something along the lines of maybe methadone, maybe would have been prescribed to you by a physician?
No, I tried to go cold turkey last time, and I was sick for almost a week before things really started getting back to normal. So no, I didn't really seek any help from anybody because I thought I could try to do it on my own. I mean, it's just pills the doctor prescribed to me at one point after my knee surgery, and I just couldn't stop taking them. So I thought I could kick it on my own since it's just, you get them from the pharmacy.
I understand. One of the things that we must take into consideration when we are faced with such temptation, we get those prescribed pills and then we feel good and we like that high. And sometimes, it can be a struggling time to move away from that. So some of the things that you can help you in your journey as you take on this battle is, get support from family. Find someone that can come in and be there for you and help you go through this, as well as removing prescriptions, pills from the house, getting rid of them, as well as making sure we focus on the safety. During those times we become unbalanced, unsteady, and we may fall, and we never know what's in front of us until we are on the ground and we see that clutter just looking back at us. As well as making sure that you have adequate nutrition and a fluid balance, okay? Make sure you're getting your fluids in and you having a healthy, complete diet.
I'm feeling really dehydrated now.
You mentioned that you're dehydrated. I think this might be the time that you should proceed and go to the ER. They'll be able to have the treatment that can kind of help ease some of this fidgeting and withdrawal symptoms that you're going through, okay? There's one down the block. If you would like, I'll be happy to go over there with you to ensure that you are seen at the local ER, okay? Okay.
So we want to tell you guys thank you for coming and thank you for sharing your story. It's a really good step that you came here for group therapy.
All right, guys, this seemed to have been a good class today. Alicia, if you want to go ahead and stick around, and we'll kind of go over some individual therapy as well as getting you over to the ER, okay? All right, see you again next week, guys.
Thanks.
Take care.
Yeah.
The National Helpline is a free, confidential, 24/7, 365-day-a-year treatment referral and information service for individuals and families facing substance use disorders. Please call 1-800-662-HELP or 4357 for more information.